Welcome to Talking Tech Journeys, hosted by me, Ben Whiteley of BPM Tech. We're delighted to bring you season 1 of Talking Tech Journeys. The aim is clear, to bring you some of the most engaging and respected figures within tech and transformation, providing a snapshot of their journeys to share knowledge, ideas and insights on all things tech and transformation. Sit back, relax and enjoy the journey. I'm Ben Whiteley, delighted to be joined by Liam Cahill, lover of analogies and a passion for reshaping organisations to be fit for what comes next, and founder of Total Digital.
Hello.
Hi there, how are you?
I'm good, thank you. Yeah, great to be joining you today.
Yeah, thanks for joining, and looking forward to delving a bit deeper. So obviously, I know, Liam, that you found consulting champion digital ideas within health, social care, advising on viability, innovation, disruptive products and services within sort of digital healthcare. So really just wanting to explore obviously that side, but before we do that, sort of get a bit of an understanding and deeper sort of look and view into who you are and what you're about, Liam. So I mean, just sort of in terms of a brief introduction, could you just share a bit of background as to who you are and what you're about, Liam?
Yeah, sure. Unfortunately, I never have the luxury of being able to kind of have a nice, convenient job title. I can say I'm Liam, and
Yeah.
this is my job title, and I work for these because I'm someone who works myself as an independent advisor. I work with national, local, and also frontline providers in health and social care. But I also
Sure.
work with a number of tech companies who are looking to take forward the digital journey in digital health or digital social care. And I suppose if there is something with the title, like the way that I'll usually introduce myself is I stop the NHS falling over themselves when they're trying to innovate, and I
Yeah.
help companies trying to understand how to work with these organizations about where they're going to fall over themselves and where everyone's going to fall over together. So if that could be condensed into a job title, I suppose that's me.
Very two distinct client bases, and looking forward to discussing it further. So thanks for that. So look, let's take you back. How, why, when did you sort of first become interested in digital health and technology, Liam?
It's a difficult question. So like I'm a geriatric millennial, Ben. Like in the sense of like I had the Commodore 64 at the ripe old age, and I've sort of
Yeah.
grown up and like been part of that huge societal change. And I've always been really interested in technology. I got really good at taking computers apart and not being able to put them back together. And obviously, I had a mission
I
when
think we've
mum and
all
dad
done
were
that.
like, what are you doing? You've just broken our computer. So I had to learn to put them back together. So like I've always been interested in technology. My background's a computer science degree. Like, to be honest, I'm not a coder. I'm not a technical person. I actually ended up gravitating more towards the thinking side, systems thinking, business around IT, information and knowledge. And as I'm sure we'll talk about, I found myself in the world of healthcare. It's quite a strange thing. I probably shouldn't say this, but I wouldn't necessarily say I've ever been entirely, hugely, specifically interested in digital health. And as given I'm arguably a digital health advisor, what I'm interested in is the beautiful complexity of the human system that is health and social care. Like I'm a systems thinker, and I absolutely love like when I came into the NHS, I never really expected to go into it. I fell into it, and I've been like I've absolutely fallen in love that for someone who loves complex systems, this is my playground. It's a place I love to work, and taking forward a system in such a difficult time has been an area. At the same time, I'm absolutely fascinated by the by the emergence of what digital technology is doing in this age, and so I'm really interested in both of these things, and the combination of those two comes into digital health. But I think a lot of people are very interested in health tech or digital, and it's very specific. But for me, it's about the phenomena of what we're going through in this age. And I suppose that's kind of, like I spent a lot of time in the NHS not thinking about health tech or digital technology, but being involved in IT and different forms of technology being applied. So I don't necessarily know the answer. Like I'm really fascinated by the technological solutions that are coming through and so on. But I think my interest is taking a step back and looking at the wider, more specific phenomena of it,
And that's it. And there's often not a specific time or spark, but like say, the whole sort of persona of technology and how it's sort of integrating across various
Yeah.
societies. So yeah, no, that's great.
Like,
I mean, so look, just in terms of obviously you touched on briefly there just your sort of NHS experience. I mean, take you back to your first job. You know, what what were you doing, and sort of how did this shape your journey and career moving forward, Liam?
yeah. Like, I think my journey is almost an antithesis of journeys, in the sense that, like, if we go back before, I was a miscreant as a child, right? I was a really problematic kid. All my report cards were like really
Yeah,
disruptive in class. What a shame, because he's actually got a bit of a brain on him.
yeah.
And I was always just in trouble. And I guess, like, my first job, my mate Suki, who I'd been on a computer science degree with, he was like, "Oh, I've got this job. It's a big NHS rollout program," which was then the electronic staff record program.
Right.
And
Okay. Yeah.
he was like, "Oh yeah, just like, I've got a job. It's paying like 30 grand a year or whatever, or whatever it was. I can't remember. I
Yeah.
think it was
Yeah.
less."
Yeah.
And like, I was like, "Yeah, I want a job. That sounds interesting. Like, it's a good first step." And so it wasn't really any intentionality around health and social care. Like, I was very interested in working in an area that was public service. Like, I've always wanted, like, my ideal when I was younger was to work for the UN. Like, I've always wanted to be a public
Okay.
servant in some way,
Right.
shape or
Yeah.
form. And so I was like, okay, NHS, it's not a big corporate company. I'm interested in it. And I suppose my first job, which I think lasted for about 4 or 5 years, was me continuing to be a pain in the arse, to be totally honest, Ben. And like, I had this weird, like, I've spoken to some others about this, but I had this weird sort of situation where, like, a lot of it was process and Prince 2 and all of
Yeah.
this
Sure.
kind of like
Yeah.
mechanical work. And I had this sort of situation where we had all these spreadsheets that we needed to do to translate the old systems to new systems. And I, like, basically didn't want to do what they wanted to do. I wanted to make it more efficient. And I was always getting told off, just do what we're asking you to do, Liam. Stop being like, stop trying to change everything. But they kept promoting me. And like, it was this weird thing where, like, I was always kind of like getting kicked a bit for stuff that I shouldn't have been doing that I was doing. It was always with good purpose, but like, I just wanted to, like, I wanted to save my time, to be honest. When I could see there was a more efficient way, I wanted to just basically improve it. And so what happened is I got promoted up and up and up, and I think I reached about 25. So I've been there about 3 or 4 years.
Yeah.
And on that national program, that was a time when there was loads of contractors, and half of the team were contractors. And someone sat me down one day and he was like, "Liam, you got a bit of SaaS." Like,
Yeah.
by SaaS, I don't mean software as a service. I mean,
No.
like,
Yeah.
the SaaSy kind of SaaS.
Yeah.
And he basically said, "Do you know I earn 3 times what you do, Liam? And you could probably get away with like doing what I do. You could probably pitch yourself as a consultant, right? So you should do that." And I was like, "Okay, I'll do that." And so I suppose that led to the next stage of my career, where I then went traveling for a little while, and I came back and I called up a recruitment consultancy and said, "Hi, I'm Liam. I'm a consultant. Can I have some consultancy work?" And this was in like late 2008, early 2009. And they were like, "Yeah, we've got 5 different things for you." And I was like, "Cool." They were like, "What's your daily rate?" And I was like, 400 a day. And they were like, "Yeah, that works." And I was like, "Wow, I've just doubled my salary. That's cool."
Yeah.
And so I think, that kind of, I suppose, ended my time directly as an NHS employee. I spent my whole career in the NHS, but actually in terms of that first job, it was a short period. But I think the thing that it really told me, my real experience within this, was that it, as an anti-institutionalist and someone who's terrible with authority and is just naturally quite disruptive, I found myself in an environment where it was all about, like, it was all institutional, and I railed against it. And I think it told me that I was in an interesting area, but that I probably wasn't the best fit for someone who works in systems in that way.
Yeah. So, I mean, was there any sort of specific sort of key takeaways from your time during the NHS?
Well, so I've continued to work with the NHS after. So I suppose if we move on to my next steps in terms of then going into my consulting within the NHS sort of directly, like, I don't know, like, I think, if there's one thing that I would take from this, and like I'm in a position where I teach disruption now. I teach the art of disruption. I teach about how in an age of complexity, and so I actually spend a lot, like I'm working very intensively with the military, and I do a lot of teaching for the military at the moment and teach this kind of stuff. It's like, like institutions are important, but they need to be disrupted in a positive way. And so I think if there was a takeaway, like if there's a career takeaway, I suppose thinking about in terms of advice for others, like there is a line where you do what you're told and nothing changes. You just keep on like on the hamster wheel.
Yeah, sure.
And then there's also a line where you're constantly like, falling out and pushing with people. I do think that there is a good area that sits in the middle where actually we need to be improving everything. And I don't think that I would have accelerated my career success at that stage as quickly if I hadn't been willing to break the rules and justify why they were. Like I wasn't breaking bad rules. I wasn't, I wasn't like smoking in the bike sheds. I'm sure as an adult I would have been fine, but I wasn't out breaking the wrong rules. I was just trying to make things better. And I think actually in this day and age, even so now, because this was 20 years ago, I was doing this, like creating good trouble. I strongly believe is an important thing to do, and being willing to do that because that's innovation, right?
No, absolutely. So I know you touched on sort of innovation there. So we'll sort of just take that next step into to your sort of career journey. When did something that spark sort of enlight in terms of when you thought, what, you can help health, social care with innovation, with technology?
Yeah, so it's probably worth me kind of like I suppose in terms of next steps, what happened is I kind of bounced around being a consultant for a little while, and then after the coalition government came in 2010, there was a huge amounts of sort of rather savage financial cuts after the financial crisis that were being implemented in the NHS. And what happened is that in early 2010, they started what was called QUIP, which was basically quality, innovation, productivity, and prevention, which is the nice way of saying we're going to cut loads of money in the NHS. And they asked me to work with a senior pharmacist working at a regional level to actually take on to try and support within the Strategic Health Authority, which was kind of the regional tier back then, to basically deliver 90 million in savings, to try and work with the local primary care trusts, which became CCGs and now ICBs, to actually try and see if they could deliver those savings, and to almost like kind of help the systems to do it. And so I think the light bulb moment probably comes at the end of the sort of the Prescript journey, which I think we'll probably get onto. But like what we did, or what we set ourselves up to do with Prescript, was to effectively roll our sleeves up and help, which then started this really exciting and interesting journey for me. Like, if I'm to literally answer your question, I've been really fortunate. My career has been a series of light bulb moments, going in, contracting, having relative freedom, like starting a business, being able to move around and really quickly get experience. But then going into this big thing that then took up the next 8 years of my life, that became a very successful national body. Like, I don't think I would have been in that place and able to do it if I hadn't have had that kind of flexibility and freedom, like in the way that I was working. I also think it was the right time as well, because I think succeeding in this environment is very, very hard. But I'm trying not to get ahead, I suppose, in terms of the journey. But would it be helpful for me to, I suppose, kind of talk about what happened with Prescript and how we?
Yeah, absolutely. Just sort of going to come on to that. Obviously, sort of. I know you sort of scaled the social enterprise, but it'd be interesting. Just, I know you touched on some of the sort of drivers, but sort of the main problems, pain points you sort of set out to serve, and who they were and what they're about, really.
Yeah, sure. So basically, we were a program that was supposed to last a couple of years to help save 90 million in the east of England. And what happened is we took a very different non-performance management approach. I had a lot of agency and freedom, and I was always about building. Let's see if we can do things differently. Let's help them. And so basically what happened is we hugely over-delivered. The NHS regions merged and we covered a wider area. And then the Lansley reforms came in 2013 and the whole system kind of changed. And we were no longer institutionally funded. So we then basically went into this massive hustle period for about 2 to 2.5 years, where what we ended up doing was trying to find if we could build a subscription model. And the intention of that, which is very different from institutionality, because institution puts money down, they give you a series of things to do, you do those things, and you report up about how you're doing. That's how it works. But what we decided is actually, why don't we take a more democratic approach? So what we did is we asked for a subscription fee from the organizations who were already very supportive of us. And what we would do is we would effectively give them control. We would work democratically. They get to vote on the work that we did. It would like everything would be working in the open. We would do annual reviews about our performance that they would review and we would put out. And that worked as a very good sales tool, I guess, because we were very different. And so like what then happened is that we got to a point where we then got almost too big and risky for the NHS. And there was an academic health science network at the time who saw that we were starting to get close to $1 million in revenue. And then said, oh, we're not very good at earning money. We'll take some of that. And they tried like what was a hostile takeover. So we didn't kind of float out of the NHS as a social enterprise. What ended up happening was we kind of got dumped out and we had a cliff edge that we needed to sort out. So my sort of co-founder, she had kind of got pulled back into systems. So my job was to set up a social enterprise to create an organization that could work independently. And we went to our community and said, this is it, sink or swim. You've got to find a way to help finance us. We're going to be a different kind of organization. And that led to us basically growing to then get to 100% coverage, covering all of the UK, helping the NHS over time to save a couple of billion in medicines and prescribing savings. I say we were like we supported them to do that. So our organization was very much about a few things. One, nice guidance. I'm sorry, this is quite technical for individuals, but national nice guidance can often be heavily lobbied and it's not very practical. So what we did is we kind of created IKEA flat pack pathways that local GPs and providers could then institute, which had data and intelligence about basically relative to where they were in the country, what they could save and how they could improve quality of prescribing against their budgets based on what everybody else was doing. So we tried to say, well, based on the best of the country, you could save this much and so on. And we also did like events and innovation profiles and best practice webinars. We built an e-learning platform. So we basically just grew out. And like, I think like, so our pain point was we have these teams are all working on their own, reinventing the wheel, needed to create all of their local policies. And we were like, well, this isn't a very effective way of working. So we collectivized. And so I left the organization in 2018, but I think the key takeaway for me, just to kind of bring this together, and sorry about time, it's a long story, is that what actually happened was we became a very different thing to how it was working in the NHS. We became very disruptive. There was a load of like long-standing institutions that were then ended up being defunded because we were there. We ended up building a lot of power, but not in a way that was accountable to NHS England. So NHS England used to come to us and say, hey, stop doing this thing. And we would go, well, we don't actually work for you. So could you provide a brief? And we'll send that to the commissioners and we'll ask them to vote on whether they want us to stop. And they were like, that's not how it works. It's like, well, it is now. So for me, and I think this is the real defining point in my career, if there is one, what I realized and started to see was that the world is changing. There are different ways of working, and a more grassroots, democratic and new power approach can really, really be effective. And it's quite alien in big institutions like the NHS still to this day. But that then set me on what I think is now my absolutely core central mission, which we may come on to, which is how do we change the way that we think about digital in the NHS? And how do we successfully improve and experiment in a very different digital age to what was, to what we had in the sort of the industrial age that we've had as we go into this digital revolution? I suppose that was kind of the real light bulb moment. And pretty much everything I have done since that point has been working towards that manifesto of let's work and empower democratically, because I saw the value and the impact we managed to have by just doing things differently. Yeah.
Which I think sort of, comes nicely into your next sort of stage, which obviously, founding together digital, you're talking a lot about innovation, disruption, and I read that, it was sort of born out of a feeling that the status quo is no longer fit for purpose, which probably just sort of resonates with quite a lot of the points that you've sort of just raised there. So, was there anything in terms of, those factors, experiences that sort of contribute to that, that the feeling that the status quo is no longer fit?
Yeah, like I think this experience with Prescript, it opened my eyes to how ineffective we are as systems, how mechanical and like slow and time consuming everything is. Now, when that's the culture, I think everybody feels that that's the only way that things can be done. I think there's lots of people in the system, and I mentor lots of people like I mentor chief execs and to people who are doing particular pieces of work, and they say the same thing to me all the time. Like this culture, this has been validated, and they go, well, I'm just a cog. This is the system. How do I change this? And I suppose the thing that I was so fortunate to have the opportunity to do, Ben, is to do things that like are a totally different paradigm of working. Like, what about if we just empower everybody and support everybody and make it about them and not downwards? And I think like all of this feeling was that I was looking at a system that was struggling and slow and really problematic. And I was looking at this unique experience that we'd managed to have. And I was thinking, something doesn't add up. And so actually what happened was I won't get the book, but I went to a talk by a guy called Sam Conniff-Land, and he'd written a book called Be More Pirate. And I was at this point as the sort of the end of sort of Prescript, because we got to total coverage. I was chief operating officer, but to be honest, I was always about innovation and doing new things. And I kind of started to feel like I was just, we'd done it. And I was like, I want to go somewhere messier and bigger. And he came on and basically talked about like, the world is changing. There's this tide of movement. And I thought, you know what? I've got to be on this wave. Like, this is what I'm about. This is what my career has to be about. And it was a feeling. And so I went back, I quit my role. I set up like Together Digital, because I'd been contracting before. I'd always had a limited company. Like when I was chief operating officer of Prescript, I stepped out from contracting back into a role. And then I kind of took my company out of dormancy and went back. So the company's been running for 2009, 15 years now. But I sort of had a 3-year period where I kind of had a director role in the organization. I reinvented my previous company and created Together Digital. And basically the process in doing it, I had a 6-month-old kid, I had no money, just lots of confidence being me. And I rocked up to a frontline health provider and I said, look, what I want to do is I want to turn everything on its head in your organization around innovation. I want to sit down with your teams and I want to create a space where we don't have this top-down project managed kind of view of innovation. I want to go to clinicians and I want to bring some technologies to them and I want to see where they want to take it. And what we're going to do is we're going to see what happens and observe it. I'm going to try and help make it safe. And then what we're going to do is we're going to see where your organization gets in the way. So I rocked up to these to a frontline provider, sat down with the CEO and the CFO and said, look, what I want to do is I want to help run experiments in your organization, empowering your clinical teams. So it's not a top-down driven approach. And what I want to do is I want to see where it goes and what we can do safely. It might be that we have some questions and hypotheses such as how could patient care be optimized in Microsoft 365 or something like that? Because I think it's a really good tool. And we're going to just try and see what happens. And then what will happen is the organization, the mechanics and the old school things will get in the way. And then we will work together and address those. And so that was basically my pitch. Like my feeling came to like, we need to do things differently. And I turned up and I went to an organization, I pitched it and I was like, I'm not going to get this. Like, they're not going to give it me. And they said yes. And so that became the next stage of my journey. So, it was born from a feeling. Like actually, when I started sitting down with organizations, I was like, look, it's not working anymore, is it? Like, I'd been a non-exec on an organization and we'd been in the bit where we spent ages building this like really long-term strategy and the world just kept changing all the time. And we ripped it up. And what we ended up doing is having a thinking framework that gave us North Stars and guidelines. And suddenly we became really good as an organization. And that, I think, was the point. We need, in this new age, this feeling. And I've had, I've mentored, I think, about 50 individuals in the
Okay.
military. I've mentored
Yeah.
CEOs. I've mentored people. I've taught long-term courses since, and so on.
Yeah.
And what I've seen is everybody's feeling this feeling. They
Yeah,
just don't
sure.
know what to do
Yeah.
it, and
Yeah.
they are. I was almost about to swear then, but they are expletive terrified, right?
Yeah.
They are absolutely terrified of what to do. And even if you go right up to the top, everyone's got that feeling and they don't have the answers. And
Yeah.
so to me, my feeling is that there are some really good answers coming through, but it entitles us to change our whole paradigm of thinking. And so I wanted to see, can we change that paradigm? And it started with a feeling, because actually I think this isn't something like we can see around us that
Yeah, sure.
the institutions are crumbling, right? Like we don't need
No, yeah,
we don't
yeah,
need to
absolutely.
have that as a feeling. But when I say to people, the status quo isn't working, it's not working anymore, is it? Like everything's moving too quickly. How do you plan? How do you get success? You can't treat everything like you did. I've mentored like CEOs of national charities who said, I don't get this. I don't know what to do, And so I suppose my work has been in terms of taking this feeling that I had and turning that into a productive energy where I've tried to seek out solutions and approaches and answers. And I don't have all of the answers, but
No, sure.
that started with a feeling.
Yeah.
And I connected with lots of people who are sharing this feeling and feel quite scared
Yeah.
at all levels.
Yeah.
And that we work together to try and do things differently in a view that we can't keep doing the same thing.
Which is, quite exciting, like say, feeding your passion for innovation and disruption. So
I love it. Yeah.
Yeah.
Like what a time to be alive. We are
So
changing the way that we think about how society functions, and working in health and social care in one of the most important endeavors that we have in our society.
Absolutely.
Gosh, where else would I be? It's the best place ever at the moment. It's my playground.
Yeah, good stuff. So just in terms of obviously Together Digital, and I know you sort of touched on it briefly, in terms of your sort of client base, have you sort of got, sort of specific clients in terms of obviously social care, digital health companies?
So
is that sort of where you pitch it?
I'll be entirely honest, right? I work right now. Can I swear, Ben?
Yeah, go for it.
Great. It's a shit show, right? We're in a total shit show at the moment.
Yeah,
There's no money for stuff. And so my life's mission. So for example, over the years, the 5 years, maybe it's 5.5, 6, I don't know. The years since I started to really started Together Digital, I've worked with tens and tens of frontline providers. I've worked in the military. I have been a special advisor for NHS, NHS England around what I do. I've helped the Health Foundation do research and think about what are the new paradigms of care in relation to technology. And so my client base has been I believe in serendipity. I was mentoring someone who's thinking of setting up a consultancy the other day, actually. And they were like, how do I know what's the plan? I keep getting all of these random things that appear. And I suppose, to be totally honest, in this world, I put out the message, I talk to people, they recommend me to people, and I work with them and get I've got right now, for example, in terms of existing clients in this area of work, I have got 2 hospices. I've got a social enterprise that does really advanced MSK provision for, I'm working with Southwest London Digital Place Group in terms of running a health foundation funded piece of work. And my job is to design that particular piece of work. So I started working with providers inside their organizations. And then I ended up building an accelerator where I took lots of organizations through, and then I built an exec course. So I think the answer is that, look, something happened in 2020. You may have heard of it then. It was a global pandemic. It was pretty big, right? And that before that point, I was very much embedded in organizations doing that kind of work. But through fortune and through misfortune that the system is really struggling at the moment. I have to where we are at the moment in terms of the dire situation in the NHS is that I don't have organisations banging down my door saying, we'd like to do radical experimentation. They're saying, we need to just bail water out the way. I think this will come in time. But at the moment, I think I work in more of the thought domains around this rather than kind of, big hands-on projects. I do a lot of stuff around digital roadmaps and thinking about digital. So what ended up happening is, so when I started, I also had someone who had a health tech company, and they came to me and said, Liam,
Okay.
look, we keep starting fires in the NHS. Like, I didn't intend to go into digital health or not into health tech, these companies. And he was like, Liam, can you just come in for a few months and like just help us make some good decisions, as we prepare for, and I was like, yeah, okay, I'll help with that. And now 32 health tech companies later, I've just been passed from pillar to post. But what happened a couple of years ago was, I've been doing it as like a side thing. Like, it was kind of, I described it as my mistress. My work and my passion was always about experimentation, the system itself.
Sure.
What I realized is, like, I know where everything goes wrong, where projects fall down. And so health tech companies who are finding that they have no control over this, that actually there's quite a lot that I could kind of give them that maybe others didn't necessarily know in the way that I did. And it just grew. And then so over the last year and a half, I've basically spent a lot more time focusing on publicly and doing stuff around digital health companies.
Yeah.
It's like, I probably shouldn't say this. It's not my passion. Like, I get great work. Companies bring me in and they will go, hey, Liam, like, come in, help us rebuild our company so we fit the NHS. I love doing that.
Yeah.
But like, my passion is about the system, and it always is. So I do this and it's great. I get some wonderful clients. I get to learn, like, in terms of my learning journey, people bring me in and I get to learn about advanced AI or cybersecurity or all of these different areas in context. And that's super cool. But the world is like, when people ask me for advice, because I think a lot of people come to me and they say, hey, Liam, like, how do I do what you do? It looks really cool. I kind of say, well, like, I describe my job as like jumping into a hurricane. I've got my mission. I kind of know where I'm trying to sail. But you have to kind of grab onto the things that are circulating around you. And this is the world that we're in at the moment. And so my mission is still true, but if I want to stay for the long game, to really be there and work my craft to help the NHS to properly reform over time, then I've got to make sure I'm still paying my mortgage for it and doing that. So I don't want to give any I don't want to give any false impressions that,
No, absolutely.
I'm just sailing through and everything's plain sailing, because it's not. Like, I'm hustling all the time to make sure that I can keep my passion project going on.
Yeah. So obviously, the innovation that's key to you. Do you think you've innovated, change your consultancy style offerings over time to suit a particular client's need? Or
when I was young, I was a firebrand. I'm not young anymore, Ben. I'm in my 40s now. I feel like an old man. I got the greys.
Not far behind.
That's it. You're agreeing with me there, Ben.
Yeah.
When I was younger, I wanted to rip it all up and start again. Like if I go back to my journey in school, I wouldn't call myself a disruptor. I'd say I was fucking disruptive, right? And I had to learn, I had to. I know, to be honest, I come from a poor background. Like, I've had homelessness and stuff like that happen in my family. I've had lots of things happen, and I suppose I've always been angry at the system and how things work and so on. I'm a very sort of left socialist kind of person. To be honest, I kind of was quite radical and wanted to rip things up. As I've gone older, I think, as I've got older, I think I had an experience where I was on the board and I was so keen to help them solve all their problems. I never really realised that actually I was just maybe joining them in solutionising. And I think, particularly over the last sort of 5 years, a lot of the work that I've gone into is around complexity and like having frameworks and approaches that I can use to, because I'm a quick guy. I come up with lots of ideas. I'm always having ideas like this.
I can imagine.
And everyone can come with me. Everyone can just follow with me, right? And I can create problems if I do that, because I don't see all perspectives. I don't have all the worldviews. So getting into complexity and design thinking and systems thinking and thinking about user-led design and empathy and stuff like that, I think has really changed me. And I think for a long time I held this view that I wanted to come up with all the ideas, but I wanted to empower everybody. And it was false. Whereas nowadays, I think I've got a bit older and I don't see myself as any kind of hero to anything. What I see myself is that I want to guide and empower others. And so much of my consultancy style has been around trying to bring sophistication of innovation and empathy and for example, when organizations are innovating, there's almost there's a real likelihood that everyone's going to fall out. It's going to get personalized.
Yeah,
And,
absolutely. Yeah.
that there's people who are blockers and stuff like that. And like understanding culture and systems and that has really kind of changed my view that actually this is systems in play. Systems create personas and create ways of acting. Systems are there to preserve themselves, and actually like inviting everybody in who would be opposing you to do things in a different way and to try things safely is the only way to do it. It's the only, you've got to build collaborators. You can't just be this like knife trying to cut through things, because you'll just get dragged down. And so, yeah, there's a lot really. And as I mentioned, like at the moment, my consultancy style, a lot of public stuff I'm doing is around helping organizations to run the NHS. I'm building a course at the moment for health tech companies around how they can navigate the NHS. Again, it's not going to be my Sistine Chapel in life, but it's something that's sorely needed. And I will put all of my love and passion into it. But I think a lot of my consultancy at the moment is focusing on organizations that are really struggling and going under left, right, and center to have the best possible chance. But I think my style is changing, and it will keep on changing because the world's changing, right?
No, absolutely. And adapt and overcome. So just in terms of, obviously, you talked about the consultancy side in terms of health tech companies and those sort of organisations looking to work with the NHS. I mean, what are the sort of common mistakes, and how do you sort of help them look and challenge and sort of navigate the choppy?
So in my course, about halfway through writing the script, I'm about 25,000 words into dealing with the common mistakes. So
right, okay,
let's put it this way: that there's a lot, right?
Yeah.
Like I suppose I wrote an article recently. Actually, if your listeners you're interested, I've kind of written something around mistakes, because I think, unfortunately, I think that if I really zoom out and look at the biggest mistakes, is I think that a lot of people who kind of come into tech kind of feel that they can come in and revolutionize care and disrupting digital and like improving. And like, as someone who spent years in the system, I think one of the biggest philosophical mistakes is that they oversimplify something and feel that they can change it from the outside. Like for me, I see, if we are to change things and see disruption, like ultimately huge disruption comes from a paradigm shift, and that's hearts and minds. That's people thinking differently. That's not a piece of technology.
No.
And I think often what I see is companies have this big narrative. And when you get behind it, it's just style, not substance, right?
Yeah.
It's not actually looking at the mechanics of how the systems will change. And so if we take that, like many companies that I work with, like companies that people know and think are doing really well, don't really know who their customer is. They don't really entirely know what problem they're solving, particularly, for example, they're solving it for the system. They don't know who to engage and how to engage. They don't know when to engage them and what time of year and how the NHS calendar year works. They don't know how to provide the right levels of leverage and incentivization. By incentivization, there's different forms. I'm not necessarily entirely talking about financial. In order to get the NHS to work with you as a partner, they don't necessarily know how to write business cases and to communicate in a language that the NHS. They don't know how to deal with the fact that the NHS is like a shroud of silence and conservatism and quietness and almost anti-private sector. And so quite often they can get their stuff out and then it's just deafening silence. And actually, I know from building our organization that we used to have some of the deafening silence, but we, in cultivating and understanding and doing it in a certain way, like from scaling an organization with the local systems, I guess, and I will say that I made a lot of these mistakes. We got a lot of it right in the end. But a lot of what I've learned about what health tech companies did, I think, is what I was doing 10 years, 15 years before, right, in myself. So, like, if I can just boil it down to one thing, I think, like, we have problems on both sides. The NHS that I work with is often expecting everyone to come and do things for them without them having to do something. They go, everything's too complex. They're stuck in analysis paralysis. There's loads of things, and ultimately they want the fruits of what this technology sector's doing, but they don't want to give them anything to get it. And then they complain, hold on, it doesn't really fit us. And they haven't done it, and because they haven't engaged with them. On the tech side, I think, if I'm entirely honest, I think the venture system is problematic. I
Mm-hmm.
think it breeds short-termism and arrogance
Yeah.
and naivety. And you get a lot of people who come in from a few years working for a big tech consultancy and think, yeah, I'm going to come and save the health system.
Yeah. Yeah.
And
Yeah.
then they get destroyed because that is never, ever, ever, ever
No.
works. And so I think, a lot of it is they go, someone's going to buy it. We'll focus on the product. We'll spend all our time winning awards for best tech company in London 2020, whatever. And then they come to a system that's hugely complex, and they've entirely under prioritized it. And so a lot of my clients, like most of my clients, tend to be longer term clients. They're the ones that receptively come to me in the early years, and over years they've come to me in their stages. And I've, I think about 80% of my tech company clients right now are returns from years before, which is lovely. It's the most nice thing that the circle's kind of turning. But like, I also talk with a number of companies, and they go, and I tell them, it's got to be more sophisticated. You've got to include these things. And I'm like, yeah, Liam, great advice, but yeah. And in a couple of years, they come back and go, we're about to go under in 3 months. What can you do? And I go, well, I'm going to tell you what I told you 2 years ago, because you haven't done any of it, right? So, like, my current mission is to try and make sure that, as a kind of like sort of like an uncle in this territory now, as I kind of grow my role, that I help these organizations to really bring the sophistication that a complex system needs in order to, because there's some great ideas that are going under right now. And this is taking us back, it's holding us back from what we need in transforming the NHS.
Like I say, you can't just go bang with software and systems and platforms and technology. It's all about, learning from a sort of more mature, informed, almost less volatile type community, iterative changes over time, and sort of trying to drive.
Yeah. Like every day I feel like I'm commenting on some statement on LinkedIn where people are like, there's one yesterday where someone's like, like nurses make loads of mistakes, and there's this chat solution that's going to do this. It's AI automated, and it's going to come and do this, and it's going to change this thing. And I'm kind of like, okay, here we go. It's really complex. Like, yes, you're looking at this, but what about this? What about this? What about this? What about this? Like, and like we have this, we've got LLMs and generative AI that's really peaked, and we're all talking about how it's going to do this, that, and the other, largely by people who don't actually understand generative AI. I've spent the time reading up on it and getting to know it. And actually, I think we have this culture outside, there's people in the system as well who subscribe to this culture that tech's going to save everything, it's going to change everything. But I suppose it could actually technologize a really terrible form of non-human provision, or it could empower a form. And I suppose if it comes back to a lot of the work I did with the Health Foundation was, how do we use technology to build human relationships? A lot of the thought work is around how do we do this? And people go, well, that's not what the system's asking for. It's like, the system's stuck, and it needs to ask for, and it goes back to that, there's this conversation. It's a big conversation. It's got lots of parties in it. And, on both sides, there needs to be that conversation. And so in my small way, I'm trying to contribute to bringing those two parties together in a different way.
Yeah, I know you've touched there on sort of the health tech companies. I mean, just briefly in terms of health and social care, I know you've sort of touched on it just there, but do you think there's any sort of key barriers sort of preventing that technology?
I delivered a 100-hour, year-long accelerator on this topic. So again, I will give you the top line. Okay. We're going into a rhizomatic digital age, which is network-oriented, where we need to have openness, network-based working, more focus on purpose at the point of context. We are going into a world of greater complexity. Digital technology is the increase of complexity in our age. I spend a lot of time teaching people complexity, and to be totally honest, like not many people really understand how to understand and respond to complexity. We have a system that treats everything as complicated. We also have a system that treats everything as cause and effect, when actually the reality is that a systems thinking suggests everything is circular and everything is connected. And we see in the NHS time and time again, like I've advised national bodies and so on. And what I see is that everyone wants the nice, easy answer that solves the problem. But the reality is that every solution creates future problems, regardless of how good the solutions are. And I think we, like I teach around agile. We have these organizations who come in, and what they do is they go, we're stuck, we're not getting anything done, we're just mired in our own bullshit, right? And then they go, well, let's get agile. And what they do is they try and get some team to like move quickly and be dynamic and stuff. It gets crushed as a cultural dichotomy because everybody still wants the same things. I think we entirely need to shift our thinking in the system to, and this comes to risk, right? People say we want to know everything in advance so we can mitigate risk. But digital technology and things out there in the world that happen, like digital, we can't say always what's going to happen. Like, a lot of my experiments with providers has been, well, we can't say what's going to happen. Like sometimes until it's happened. That's the whole point of agile, that we test it in the reality. And yet people are like, yeah, but what about risk? And, I sit with boards and say, there is a chain where you are basically destroying the thing before it's even got started. And that's what we need to address in our thinking. The good news is, for example, NHS providers and some of the stuff that's coming from them is starting to talk about moving from gateways to experimentation and so on. But I think at the moment it's getting lip service because in the system, it's all very reductionist and institutional and short term and reductionist and technology. So there's a whole range of, like I leave tech till last because we've got cultural operating systems, we've got problems with skills and not letting people have the right amount of soft skills. So I could go on for 100 hours on this, quite literally. So there is a lot that needs to happen on both sides, like in the system, there is much more than we need to do. Like it's much easier to get a tech company to think about, like, they don't understand all of the complexity, but to work towards it and getting the system to really change some of the problematic behaviors that is crushing our ability to innovate into a better future.
Well, look, I know I could probably talk for hours and hours, but it's been a great pleasure talking to you today, Liam, and lots of great insights. So
it's a pleasure to join you, Ben.
And obviously to the listeners, it'd be great to just get your views and opinions on what Liam said today in terms of the common mistakes across health tech companies, but also barriers to preventing innovation across technology in the NHS. So thanks for listening. Thanks for listening. We hope you enjoyed Talking Tech Journeys, and we'll catch you next time. Good company and colleagues in a career make the journey more rewarding. If you did enjoy, please take a moment to subscribe, rate and review us on your favourite podcast platform. It really helps us reach more listeners like you. Don't forget to follow and join the Talking Tech Journeys podcast group on LinkedIn, where you can join in debate and message us directly if you'd like to be considered as a guest, have any questions, comments or topic suggestions. You can also email ben.whiteley@bpmtech.co.uk. Until next time, enjoy your journey.